Science journalist Laurie Garrett has been covering infectious disease outbreaks for over 30 years. In 1994, she wrote a New York Times best-selling book called The Coming Plague, about the emergence of newly discovered diseases around the globe. 2 years later, she won the Pulitzer Prize for her reporting on the Ebola outbreak in what's now the Democratic Republic of the Congo. The year after that, she won the Polk Award for her reporting on the public health crises in the former Soviet Union. Laurie Garrett is now covering the ongoing coronavirus outbreak for Foreign Policy magazine. She recently wrote a piece there titled, "Trump Has Sabotaged America's Coronavirus Response." Laurie Garrett, it's great to have you here. I would shake hands, but I got to do that.
We'll do the bump.
All right. My sense is that you are trying to sound the alarm, both about what you expect to be the scale of this health crisis, but also about the American government not being prepared.
Exactly. We're not prepared at all. I mean, I think there's a kind of inability to really grasp the seemingly unimaginable, how bad this will be, what it will feel like in America if we get a China-scale experience with this virus.
In terms of the lethality of this virus, I've read and benefited from a lot of your work about lethal viruses like HIV. This is a virus that seems to kill about 2% of the people that get it. What is that? How should we understand that as compared to, say, a fatal flu epidemic or other kinds of diseases, H1N1 or SARS or other things that we've worried about in terms of their kill rate?
Well, we've had two truly horrible pandemics in modern time. One is HIV, and the other was the 1918 flu pandemic. Now, HIV killed 100%. I mean, if you didn't have treatment, and you were unfortunate enough to get infected in the 1980s, 1990s, it was a totally lethal experience. Flu, in contrast, 1918, exact same lethality rate as what we're looking at now. In fact, lower, probably about 1.9% lethal.
And this is 2% lethal?
At least. Some of the cities in China are reporting lethality rates as high as 6%.
In terms of our government, the kind of public notice that was made today by the CDC, a senior CDC officer doing a public press briefing today warning Americans literally this could get bad and we should start to talk within our families and in our communities about the kinds of measures that we might need to take, including closing schools, keeping people home from businesses and those sorts of things. Do you feel like the U.S. government is sort of timing those kinds of public alerts correctly? Are we past due for that sort of thing? Is it possible that it could cause an overreaction at this point?
It's long overdue. We should have been ready already, and we're not. Every single company that has more than a handful of employees should have an epidemic plan in place. Do you have a way so that your workers can work remotely and not come in, not congregate, not infect others in the workplace? Every school, every university should be looking at how to have more and more of the coursework be handled remotely. We should have plans in place regarding what is essential personnel that must be in place, must go to work to keep the sewer systems pumping sewage, the water systems pumping water, the electrical systems working, and supply chain for essential goods and foods. You should look at what's been happening, Rachel, in China. You look at things like convoys of trucks as far as the eye can see, bringing food into Wuhan. Could we do that?